Let's talk about what is a sinus infection to start. A sinus infection is this inflammatory process that happens inside your sinuses. You have this mucous membrane and it gets inflamed for some reason. It could be from a bacteria that get an antibiotic. Maybe it clears, maybe it doesn't. But it could be from various other infections like viruses, funguses, etc. It could also just be an allergic process from certain foods or environmental allergies. So just taking an antibiotic for a sinus infection many times doesn't clear it because there's so many other things that could be going on. It's just this inflammatory process going into the sinuses, and we give it the name a sinus infection. So when does it actually become a chronic sinus infection? This is when you are dealing with a sinus infection for at least 6 weeks or more. In medical terms, we call it a chronic sinus infection. I know many of you are like, hey, I've been dealing with this for years, but yeah, just 6 weeks or longer, we give it that term. Most of my patients that are coming into me have been with it for years and not really getting good traction with it. So yeah, that's chronic. When you've been doing it with a long time. Acute is when you just been dealing with it for less than 6 weeks. Yeah, let's just say someone gets a sinus infection every year or twice a year and it goes away, then goes back. I would put that in the chronic sinus infection, even though it doesn't fit the medical terminology perfectly. But the reason why it keeps on coming back is your sinuses are inflamed. You're just not having a lot of reaction, and they just become a lot more inflamed when you do feel like you have the symptoms. And then it just becomes less inflamed, more inflamed, less inflamed. And then you have this imbalance of your microbiome inside your sinuses that's imbalanced. And that's why when you get exposed to a certain bug, it just blows up and becomes really inflamed. So yeah, I would put it in that category, even though it doesn't fit perfectly. What are some of the symptoms that patients could be experiencing if they have a sinus infection? It's more than just, okay, you have a runny nose or you feel congested, or you might have some pain in there. These are quite common, especially if you have chronic sinusitis. Usually you're going to experience a ton of pressure in there, even acute you will too. A lot of pressure, runny nose, sneezing, etc. But what comes along with it a lot of times is a headache and also a lot of fatigue. And then you can get body aches throughout your entire body, lethargy, body aches. These are some very common symptoms. A lot of my patients will get a lot of brain fog that comes along with this too. So yeah, can chronic sinus infection lead to vertigo? Yeah, it's when there's either it became so bad, it actually damaged the nerves. It left the sinuses and actually went into the ear canals and started damaging the nerves in there. But in most of the case, it leads to vertigo because there's this congestion mucus that is formed inside the ear canal, messing with the nerves in there, which balance the fluid balance. Also, your fluid balance gets messed up. The nerves don't work appropriately. And then, yeah, it leads to vertigo. So that is something that can happen. It's not as common, but definitely a symptom I see in patients when it gets really bad. So why is conventional medicine not very good at going after chronic sinus infections? The big problem is conventional medicine usually is just looking at an infection most of the time. They're usually looking, oh, it's a bacteria. And that's usually where they're at. Okay, I'm going to look at certain bacteria. And they forget the other infections out there, like viruses or funguses. Now, there are some ENTs out there that are good that are looking at the fungus piece, but then they're not looking at the allergic piece. And let's go a little further. The allergic foods could be a cause of chronic sinusitis. And I see this at least in 95 of my patients with chronic sinusitis. They have some type of food allergy to gluten, dairy, corn, soy, chocolate, etc. Dairy is a very common one I see. If, even if someone doesn't have an allergy to it, usually I'm eliminating dairy from their diet because it increases so much mucus and it makes everything worse and we're not able to attack this infection very well. Another big reason behind it is majority of conventional doctors and natural doctors for that matter too, is they're forgetting that bugs, let's say a bug is the cause, which is very common. Bacteria, virus, fungus is a cause. They form a biofilm. So the biofilm, especially chronic infections, always have a biofilm. It's this mucus outside of the bug. It actually a biofilm. It could be a conglomeration of virus and bacteria and fungus all in this biofilm. But if you don't slough off this biofilm, that mucus wall on the outside, we could get all these antibiotics or antifungals, or we could change your diet a great deal. It's never going to get better because we're not able to kill off that bug. So we need to give a substance or treatments to be able to slough off that biofilm so we're able to kill off these infections that are lingering in there. What is the most common cause a chronic sinus infection. So we've touched a little bit about this, but let's review and go much more in detail on the causes. So one big cause is bacteria, virus, fungus. It could be an imbalance of the bacteria that are supposed to be in there. We talk a lot about the gut, that you have a microbiome, right? You're supposed to have enough of certain bacteria. Our sinuses are the exact same way. They have to have a good balance of the bacteria in there. Or if you don't, you're going to get exposed to any bug on the planet you breathe in through your nostrils is going to cause an inflammatory response. So it needs to be working on that microbiome hanging out in the sinuses. Also, we need to look at certain foods that people could be allergic to, because that's a cause of that. A big one that I see, even here in the state of Utah, where it's dry, is people could be sensitive to mold. Mycotoxins in the mold, they go in, they breathe it in, and it causes this inflammatory process inside their sinuses. So these are some of the big ones that are related to just the sinuses. But there are all kinds of causes that I see people have when they get chronic sinusitis. They usually have all these underlying things going on in their gut. Almost all my patients that have chronic sinusitis don't have a healthy gut. They have something going on there. They have leaky gut syndrome. They either have SIBO, which is if you have too many bad bugs in your small intestine. They could have something called SIFO, small intestinal fungal overgrowth. They have fungus that is not supposed to be in there. They could have candida overgrowth. They could have inflammatory bowel disorder, on and on and on could be going on in the gut. So we need to really work on the gut health. And then I see that they have not just infections in the sinuses, they many times have chronic infections throughout their entire body, maybe Epstein-Barr virus, cytomegalovirus, chronic strep, etc. And I also see, and this is one that can be really common with my patients that have been to everyone. They've been to the conventional docs, they've been to the alternative docs, and the integrated docs, and they're not able to get this taken care of because they have something called Marcons, which is a staph that is very difficult to go after and it has antibiotic resistance. And you just need to know how to go after that appropriately to treat that. So that's a few, not all the causes of chronic sinusitis, but it gives us a good idea there. So let's talk a little bit more about Marcons. So this is a staph that is antibiotic resistant. Most patients that come into me don't know that they have it. I do have some patients that have found out that I'm good at treating Marcons and they come in for that. The majority of this have chronic sinusitis. They've done so many treatments, they don't know what's going on. And we're able to identify it. We do a test to identify that they do have Marcons, and then we treat it appropriately. So let's talk about some of the treatments that I do. This is not an episode where we could go and put too much detail on this, because remember, I talked about all these different causes. So the treatment's going to be variable. It's going to be different for every tiny little patient with chronic sinusitis that comes in. But I just wanted to give a little teaser. What are some of the treatments that we could do for chronic sinusitis? So one of them that I really like is intranasal nanoparticle silver. It has to be nanoparticle clear silver. Just don't do clear silver. It's not as potent. It's not as strong. It's not going to get eliminated from your body as well. But a nanoparticle silver, you do 5 or 10 squirts into each nostril, can be a good treatment. And it also has some biofilm breaking capabilities to it. So that's a good basic treatment. For some of my chronic sinus infection patients, they just need to do that and it clears the issue. I like something called artemisinin. I like to do that orally. I like to do it IV. Many of my patients that have chronic sinusitis, they many times need to do an IV of artemisinin of some sort because it works really well. It's broad spectrum. So like I said, most patients with chronic sinusitis have various bugs hanging out there. Many times it's bacteria, virus, and fungal. Almost all my patients have bacteria and fungal issues going on. It's very common. So we want to do a treatment that has those effects. It has an antiviral effect, antifungal, and antibacterial. And artemisinin is one of those substances. Nanoparticle silver is one of these substances also. So let's talk about some biofilm treatments, because this is really important. My favorite one is a compounded medication that I had that you put several substances together to make a new substance that's very very good at breaking down this biofilm. And that is a combination of bismuth subnitrate, alpha lipoic acid, and EDTA. I have a compounded pharmacy make that. You take it orally. It works great. We also have a natural substance that I like to prescribe to my patients, and it is black seed oil, and it works really well too. Not as strong as the substance I just talked about, but it can work really well in eliminating that. And then we want to dive in. Like I said, most of my patients have food allergies, so we need to identify that. Many times I'm going to do a leukocyte histamine response test to identify what foods might be producing histamine in their bodies that are causing this inflammatory response inside their sinuses. Then I'm going to work on healing up the gut, making sure they're eating a good anti-inflammatory diet. I'm going to identify and look to see if they might have mold exposure. If I see that they do have probably mold exposure in their house, I'm going to give them a test kit to see if they do have it. Many times I'm going to do a urine test to check to see if they have any mycotoxins in their body that could be related to what's going on. So that's just a basic rundown of some of the stuff I do for patients that are dealing with chronic sinusitis. So what do I do for someone, let's say we treated the chronic sinus infection, it's gone now. What do we do to keep them feeling good? We need to make sure the gut is healthy. You need to make sure you eat a good, healthy diet. You need to decrease the refined sugar. You need to decrease the dairy. And many times you need to decrease how many grains you are eating in your diet, especially wheat. Because the three most common inflammatory foods that we have are wheat, dairy, and refined sugar. Chronic sinusitis is your sinuses are prone to being inflamed. So you eat an inflammatory diet, your sinuses are going to get inflamed. So we need to eat a good foundational diet that's anti-inflammatory. We need to continue, if you can continue following a good diet, your gut's going to stay good and healthy. Many of my patients, and I didn't talk about this before, is we do need to put you on some probiotics to balance out that dysbiosis, give you good bacteriophores, and that will help balance out the bacteria inside your sinuses. So we're not able to, you just get a bug that comes in and causes this chronic sinus infection, that a certain virus or a bacterial infection makes everything really worse. If we have a good balance of our bacteria in there, we have good microbiome in our sinuses, we're going to be good there. So those are some of the basic things to do when you have chronic sinusitis and it's clear is follow a good diet, keep your gut healthy. Probably won't get an infection again. Yeah, if you would like to receive treatment for chronic sinus infections, you can visit our website, integrativemedica.com. Find our phone number there, give my receptionists a call, and they can set up a visit with me or some of my other great doctors that we have here at Integrative Medica. You can also sign up directly from our website and get it done there. If you want to learn more about staying healthy, click my videos to the right. I'm Dr. Jake, and I'll see you there.